I haven't seen anything that decreases blood sugar as quickly as this. And I'm not referring to harmful fads, severe diets, or starving. These are scientifically supported methods that help you quickly regain control over your blood sugar, reduce your A1C, and increase insulin sensitivity. Therefore, if you're experiencing unusual spikes after eating, or if, following each checkup, your A1C is gradually rising, or perhaps you simply feel worn out, irritated, or trapped, you should watch this video. Let's begin by discussing the first of 7 scientifically supported strategies for rapidly lowering blood sugar. The first is HIIT, or high-intensity interval training. I'm sure you've heard me discuss weight training and cardiovascular training as ways to enhance blood sugar levels. They're amazing. Thus, continue doing them. However, nothing compares to HIIT for quickly lowering blood sugar. Even in the absence of insulin, brief bursts of high-intensity exercise, such as bodyweight squats, cycling, or stair sprints, significantly enhance your muscles' absorption of glucose. HIIT decreased A1C, fasting blood sugar, triglycerides, and LDL while increasing HDL, according to a 2024 meta-analysis of 22 randomized controlled studies. The effects were particularly notable in individuals under 60 and within 5 years after diagnosis. That's probably because their bodies are more adaptable, they can recover more quickly with the correct adjustments, have less long-term damage, and still produce insulin. What is the mechanism causing this rapid reduction in blood sugar? Your muscles become glucose-hungry vacuums that draw sugar from your bloodstream to replenish themselves after quickly using up stored glucose. Here's how to use this in the real world. HIIT can be performed 3 to 4 times a week for a total of 20 to 30 minutes. Each workout lasts less than 10 minutes. For instance, 30 seconds of vigorous exercise, such as jumping jacks, spin, assault bikes, or jump squats, followed by a break. Do this 5 or 7 times. Insulin sensitivity rises for 24 to 48 hours as a result of this. It works quickly and gains momentum because of this. Apple cider vinegar before meals is number 2. This one is very straightforward yet effective. However, there are certain restrictions. Numerous studies have shown that consuming just 1 tablespoon of apple cider vinegar in 8 ounces of water prior to meals might reduce the post-meal increase in blood sugar by as much as 20 to 34%. What is the action's mechanism? Acetic acid, which is included in ACV, slows down stomach emptying and improves your muscles' absorption of glucose. Here's something crucial to think about now. Even if ACV works, frequent daily use over time might damage tooth enamel and cause esophageal irritation. After only 1 use, I experienced a burning sensation that persisted throughout the day. I wouldn't advise using it for an extended period of time, while some people can handle it well. Although it's a workable hack, I believe the following suggestion is a better choice. Third, magnesium glycinate plus berberine. Let's have a proper conversation about supplements. In more than 50 randomized trials, berberine has been demonstrated to improve insulin resistance, lower fasting glucose, lower A1C, and support improved lipid levels. It's frequently called nature's metformin. What is the action's mechanism, then? Your cell's natural energy regulator, AMPK, is activated, which improves glucose absorption and initiates fat burning. Although it's oversimplified, I won't discuss it in this video. Just be aware that you must take at least 1,000 milligrams of berberine daily if you're interested. For round-the-clock coverage, we actually advise taking 600 milligrams in the morning and 600 milligrams at night with breakfast. Below this video, we'll provide you with a link to a discount coupon. Here's the real deal now. Magnesium deficiency is common in persons with high blood sugar, and it is essential for insulin signaling. According to studies, between 14 and 48% of individuals with type 2 diabetes have a magnesium deficiency. I am aware that's a broad spectrum, but the most important thing is this. Low magnesium leads to increased insulin resistance, poor sleep, and poor glucose control. For this reason, we advise taking 275 mg of magnesium glycinate before bed in addition to berberine. It supports blood sugar, is easy on the stomach, is very bioavailable, and promotes deeper sleep. The fourth tip is to take a 15-minute walk after eating. When you're done eating, go for a walk. Don't even consider it. It's not a marathon. Not a trek. Just a quick stroll of 15 to 20 minutes. Why? Because insulin is not necessary for your muscles to pull in glucose when you move. It's known as contraction-mediated glucose uptake, and it functions similarly to turning on a vacuum to draw sugar from your blood. Walking for 15 minutes after meals was found to be more beneficial than walking for 45 minutes once a day at lowering post-meal blood sugar, according to a 2017 randomized crossover research. This is one of the most underutilized hacks, despite being extremely easy to use. Expert advice. Do this every day after lunch and dinner. Over time, it compounds. The fifth is fasting and diets that mimic fasting. A break from eating is the best way to lower blood sugar, but it must be done correctly. I'm not referring to self-starvation. I'm referring to either eating within a set time frame, such as 16 to 8 fasting, or periodic fasting mimicking diets, which provide your body with nourishment while deceiving it into a state of fasting. With the 16 to 8 method, you essentially only drink water for 16 hours of the day and have an 8-hour window for feeding. For instance, stop eating at 7 p.m. and resume eating at 11 a.m. the following day. Most folks can do it. In fact, the FMD diet allows you to consume specific nutrients throughout the day that deceive your body into believing you are fasting. This has fascinating research behind it. Reading Dr. Valter Longo's book The Longevity Diet taught me about this. I've experienced both forms of fasting, and my insulin sensitivity has improved greatly. Additionally, studies indicate that 5 days a month of FMDs can reduce fasting glucose levels, increase insulin sensitivity, decrease abdominal fat, and lower A1C readings in a matter of weeks. Your body starts burning fat instead of storing it, which helps your cells operate again. Resistance training, also known as the glucose vacuum upgrade, comes in at number 6. Walking is fantastic. HIIT is fantastic. However, do you know what improves those? Genuinely possessing sufficient muscle mass to absorb all of the blood sugar in circulation. To enhance that effect, resistance training is necessary. Your muscles store glucose. Your body can store more sugar if you have greater lean muscle. The analogy is as follows. The glucose vacuum is activated when one walks. However, resistance training increases the size and power of your vacuum. Begin with 3 to 4 30 to 40-minute sessions per week. Pay attention to full body exercises like presses, lunges, rows, and squats. Dumbbells, resistance bands, or simply your body weight can be used. Every workout helps you control your blood sugar levels even when you're not exercising, increases your strength, and enhances your insulin sensitivity. Finally, but just as importantly, 7th, stress and sleep are the unspoken causes of elevated blood sugar. You may improve insulin sensitivity by doing everything correctly, including diet, exercise, and supplements. Your blood sugar won't comply, though, if you're not getting enough sleep or under a lot of stress. Therefore, getting a better night's sleep tonight can help lower your blood sugar levels the next day. Insulin sensitivity can drop by up to 25% the next day after only one restless night. This substantial drop was caused by the study participants sleeping for only 4 to 5 hours as opposed to 8 hours. Therefore, it's a serious issue if you don't consistently get enough sleep. Additionally, stress causes the release of the hormone cortisol, which causes your liver to release glucose into your bloodstream. Your blood sugar won't drop if your stress levels are consistently high because cortisol levels are also likely to be high. What then is helpful? I've spent the last few years trying to get the best sleep possible, and I've found a few things that do the trick. Here's what I do. Magnesium glycinate should be taken an hour before bed. At precisely 275 milligrams, this is the only dosage you require throughout the day. It calms my racing thoughts, relaxes my muscles, and prepares me for deeper, more restorative sleep, which is now shown to be essential for insulin sensitivity. Second, ashwagandha helps control cortisol levels. I've slept better and woken up feeling rejuvenated thanks to this. I use black pepper along with 655 milligrams to improve absorption. Third, before going to bed, practice meditation or breathwork. This one is really beneficial. It helps me relax and get ready for bed by lowering my heart rate, which I can measure with Whoop. Avoid overanalyzing it. Simply lay in bed for 5 minutes, take deep breaths, and then close your eyes. I used to overanalyze it and search for video meditations or follow particular breathing techniques, but spending 5 minutes concentrating on deep breathing was what kept me consistent. To summarize, the 7 quickest methods for lowering blood sugar levels. 1. Interval training at a high intensity. 2. Before meals, use apple cider vinegar. 3. Magnesium glycinate plus berberine. 4. Walks after meals. 5. Diets that imitate fasting. 6. Strength training. 7. Stress and AMP. Sleep management. Start this week with choices 2 or 3. Both you and your labs will notice the difference. For connections to supplements, free food plans, and our exercise manual, see the description. Please like, subscribe, and let me know what you would like me to discuss next if this video was helpful. You're capable. See you at the following one.